Good afternoon to everyone and welcome to today's session. Vanisri, Anuhya, Rituraj, Sara, Biju, Deepika, Payal and many more who are across the country. We are a bit late but we will make the best use of this wonderful afternoon, and a good number of you, I'm quite sure, have answered the question paper, the online test. That's the reason I'll be a little faster in solving the questions. I always advise you, take the test before and attend the discussion. It will be very interesting. Now doc, revised trauma score. What does it basically contain? It has the Glasgow Coma Scale, systolic BP, respiratory rate. So these are all combined together. The revised trauma score has been created. Can online students punch whether the voice is loud and clear? Now, which is not true about extracapsular fractures of the upper end of the femur. Extracapsular fractures typically are accompanied by first of all, what are extra and intracapsular? So you have the joint capsule and any fracture in this area is intracapsular. Outside that you have a trochanteric fracture and a subtrochanteric fracture which are outside the capsule, which are called extracapsular fundamentally. So if you look at the intracapsular fracture, the intracapsular fracture is associated with shortening and externally rotated limb. So that is a very characteristic feature with regard to the intracapsular fractures. Now, if you look extracapsular versus intracapsular, one of the favorite questions of the examiner is, which is at a risk of avascular necrosis of the femur? You should be very sure that intracapsular fractures have a greater chance of avascular necrosis, non-union, malunion and degenerative changes. Whereas extracapsular fractures, they heal very well, and only thing is, if you happen to put a device to fix them, subtrochanteric fracture have a higher rate of impact device failure is what you have to remember. So why avascular necrosis is less common in case of the extracapsular fracture, doctor? Because there is a large amount of cancellous bone in the extracapsular area. It has got a very good blood supply. Whereas in case of the intracapsular area, that is the femoral head and femoral neck, there is a very little cancellous bone available. That's the reason it has got a relatively poor blood supply, and intracapsular fractures are more vulnerable to the avascular necrosis is what you have to emphatically remember. Now, in chest wall reconstruction, what is the preferred method? A pedicled muscle base flap. So you have tensor fasciolata, gracilis, gluteus maximus, sartorius, latissimus dorsi. These are the various muscle flap, muscle base flap, pedicled muscle base flap, which is available for you to use. A 25-year-old had a blunt injury of the chest. He is having flail chest. How do you want to manage him? Tracheal intubation, endotracheal intubation and positive pressure ventilation is the method. So what are Donovani bodies? Donovani bodies are those large mononuclear cells with the gram-negative rods within the cytoplasm, which are called as the Donovani bodies. So these Donovani bodies look like this. In a Buffy coat preparation of the blood and the bone marrow aspirate, and the aspirates which are being taken from the enlarged lymph nodes, typically they show around 60% of the cases there is a yield of the Donavanni bodies. Now this is a very interesting question, doctor. I want you to give your answer. I'm very happy to see 40 online students on this wonderful Sunday. We have seen the summer, we are seeing the rains, and the winter is going to come. So when the results of the NEET PG come, some of us will be shocked that oh, we could not make it this time. Still there will be a little hope. अच्छा भाई काउंसलिंग के टाइम पे देखेंगे कुछ सडनली लकी चीजें हो सकता क्या, some miracle will happen. Counseling will also be over. So it will be very hot, sweltering sun. At least by April, May, we should wake up and accept the reality. If it is July, almost it is the rains. Next 5 months is a golden time available for us for the preparation. Every day evening 6 to 8 we have a interactive session and a 20 image based question quiz. Every Sunday we have a grand test and a discussion. In addition to that, we have about 600 hours of video lectures arranged in 120-day program subject wise, and a daily test and a 100 MCQ daily test, and there is a discussion video on the daily test also in the online mbbs.com video library. This 5 months is a wonderful time where you can be able to spend effectively and cover 30,000 MCQs, concepts, basics, identify which areas you are really lagging behind, and there is no miracle, you will be obviously making to the top rank in the NEET PG. So doctor, it is all a question of perseverance. Now, you are seeing a finding. What is this finding that you are seeing? This is called rubeosis iridis. Rubeosis iridis, where there is a vascularization, neovascularization. So central retinal vein occlusion, diabetes mellitus, Yields disease. Yields is a hypersensitivity to the tuberculin protein that lead to development of a periphlebitis of the vessels, and that lead to hypoxia. Any hypoxia stimulates neovascularization is what you have to basically understand. Trotter's triad. Very good. Anuhya, Sara, Dr. Vikash, everybody keep punching your answers so that parallelly you are also revising. Okay. Only thing is I will be going little fast because Sunday test and discussion is meant to cover as many questions as possible. Only those questions where we require a little bit of explanation, detailed analysis, there only we will slow down. Trotter's triad में in invasive nasopharyngeal carcinoma, there is a conductive deafness, elevation and immobility of the homolateral soft palate, and there is a pain on the side of that particular head. That particular side there is a pain. They are all true statements. Multiple cranial nerve palsies is typically a feature of nasopharyngeal malignancy. If there is a nasopharyngeal malignancy, it will try to go and hit on the base of the skull. There are a lot of foramina in the base of the skull. Foramen rotundum, foramen spinosum, lacerum, etc. So these cranial nerves are coming out of them. So this nasopharyngeal carcinoma will hit the base of the skull, and that is the reason multiple cranial nerve palsies is the presenting feature in case of the nasopharyngeal malignancy. Which is the cranial nerve most often injured in the patients with the following clinical sign? What is this clinical sign called? Can anybody tell what is this clinical sign in a traumatic patient where there is a bleed behind the ear? इसको क्या कहते हैं? फटाफट. Please punch your answer, doctor. Let's make it a bit interactive. Please punch your answer. Yes. Very good. Anu here rightly says battle sign is what you have to remember. So battle sign ho gaya ka matlab there is a middle cranial fossa injury. So in middle cranial fossa injury, 8th cranial nerve is the one which is most often affected. So if there is any black eye, that is a sign of anterior cranial fossa fracture. If there is a bleeding behind the ear, then that is a sign of middle cranial fossa fracture, is what you have to basically understand. Now, what are all the agents which are given inhalationally in general anesthesia? Enflurane, isoflurane, halothane, but not prilocaine. Prilocaine, lidocaine is available like a cream, is what you need to understand. A 8-month-old, history of excessive craning, the child is pale and pain is recurrent, and there is passage of blood, red currant jelly like stool per rectum, and you have taken a abdominal imaging. So what is your uh, clinical diagnosis, doctor? That's right. Ashish Pandey rightly says raccoon size are the classical feature of anterior cranial fossa. Huh. So this is a classical example of acute intussusception. So you find one part of the gut within the another part of the gut. So it is called as target sign, like a target, 2 rings. That is what you typically come across. Anticoagulant therapy de rahe to INR should be maintained between 2.5 to 3.5. Acute compartment syndrome में there is a severe pain, muscle tenderness, and a distal sensory disturbances, which are the classical features. Hypothermia में what is the classical ECG finding? Osborne wave. Typically, when the QRS complex is hitting the T wave, you have a ST, there is a J point. At the level of the J point, you get a wave, which is called as Osborne wave. Give me the board. So you have a P wave, you have a QRS, and there is a T wave. The point where this ST segment and the S wave are touching each other, here one more, if there is a wave that comes, that become the Osborne wave. A Osborne wave is at the level of the J point, and that is a sign of hypothermia, is what you have to remember. At least there will be 2 questions on ECG in the NEET PG exam, doctor. So in our top NEET PG in 120 days के list में आपको there is a 8 hours discussion we have done on the ECG. One of our evenings only we have discussed. four evenings we have discussed, and about 8 hours complete discussion on ECG is there. Distal glycemias mein what are the ECG changes? How do you identify arrhythmias? What are the blocks? How to calculate the axis? What is the rate? What are the different SVTs and VTs? What are the differences? And what is LBW, left bundle branch block, right bundle branch block, William, Marrow, they are all the various ways to remember, right? So all those things we have discussed and made available in the video library. So please take a chance to review. Devanshu Sarkar, late but latest to the Sunday class. So good. 48-year-old presenting with hypotension, BP of 80/60. So what is this ECG showing? It is showing a broad QRS complex tachycardia. Unless proven otherwise, broad complex QRS complex tachycardias are considered to be VTs. Narrow QRS tachycardias are considered to be supraventricular tachycardias. That is what you need to remember. So whenever VT is there, whenever there is a hypotension, what is the treatment? It is the electrical cardioversion without waiting. But if the patient is hemodynamically stable with VT, then you can try lignocaine, amiodarone, bretylium, etc., etc. Right? So VT, SVT, you have to be 100% sure. A 60-year-old hospitalized presented with acute breathlessness and ABG is showing PaO2 of 66 millimeters of mercury, and there is a pH of 7.42 because he is ventilating, no? टेकिप्निया है तो रेस्पिरेटरी अल्कलोटिक रेंज में रहता, फिर भी PaO2 is low and ECG is being shown to you. इस ECG में क्या दिख रहे हैं डॉक्टर साहब? So in the lead one there is S wave. How do you identify S1? S wave? Q means any negative wave before the positive R wave. You should be very clear on the terminology, doctor. So this is the QRS complex. Any positive wave is called R wave. Before R wave, जो भी negative wave होता है, that is Q wave, and जो भी negative wave after the R wave होता है, वो S wave. So lead 1 में you get a S1, lead 3 में you get a Q wave, Q3, and lead 3 में there is a T wave inversion, S1, Q3, T3. Let us look into the ECG, doctor. So, can you give me the slide? Lead 1 में after the R wave there is a S wave. You are able to see, right? हाँ, S1. Lead 3 में before R wave there is a Q wave, negative wave. And lead 3 में there is a T wave inversion. So S1, Q3, T3 is an important indication that there is pulmonary embolism is what you have to basically remember when you suspect pulmonary embolism. Ventilation perfusion scan is the one which is a very good screening investigation. But nowadays CT angiography is the gold standard. But a pulmonary embolism patient with so much dyspnea, unable to hold the breath, it is challenging to do CT because CT requires some holding time of the breath. So, but otherwise CT angio is the gold standard. Now, you have been shown a radiograph of a child. So you are finding ring shadows. Ring shadows always mean bronchiectasis. It is a central bronchiectasis you are able to see. Centrally. Even in the CT you can see central bronchiectasis. Central bronchiectasis indicates ABPA, allergic bronchopulmonary aspergillosis. इसमें क्या क्या चीजें होते हैं? What constitute the definition of it? Very happy to see 55 students across the country attending the NEET PG online discussion. Invite your classmates also, right? So we love to see more and more of you every day getting confident in preparation, and after the NEET PG is over, when you join MSMD, you should call us and send us a laddu that, sir, I got in MD Gynops, I got in MD General Medicine, I got in MS General Surgery. We will be very happy to listen that news. But let me tell you, the teacher's role is only like an enzyme, like a catalyst. You are the substrate, you are the product. टॉपर आपके अंदर बैठा हुआ है, उसको जगा के बाहर निकालना है, and you have to make the topper come out of you, and that will only come if you are filling all the gaps wherever you are falling short. Generally we pass out anatomy, physiology, biochemistry. Yes sir, passing MBBS is anybody will do, right? But every year we miss some topics, every subject में. That's how first year, second year, third year, final year will also be over. Exam pass होना एक art है. But entrance exam जब आता है, those things that we left in the back in our MBBS first year, second year, उस topics के ऊपर deeply questions पूछता है examiner. So now it is the time to quickly fill those gaps. Those topics which you have left behind, like antidepressants, antipsychotics, we don't read them. There's no need of reading them to pass MBBS exam. So that is the reason this next 5 months, you have to realize where I am going wrong. What are the topics really I am very bad. So that is the reason our daily evening 6 to 8 discussions will keep precipitating you some of the topics. But after the 6 to 8 is over, you need to go back to the onlinembbs.com video library, top NEET PG in 120 days program, and pick up those topics. Even today, Sunday grant test also. Those topics which you are feeling little wobbling, they are the ones who you need to go back and attack them, do the revision and get strong. And next time you should not do mistakes. That is the whole purpose. So there is a peripheral eosinophilia, central bronchiectasis, bronchial asthma is a part of the criteria, but Aspergillus fumigatus culture is not the part of the criteria to define ABPA. So you should know, doctor, what are the diagnostic criteria? इसके पहले भी बहुत बार हम चर्चा कर चुके इसके बारे में. Raised immunoglobulin E and Aspergillus fumigatus specific immunoglobulin G or E is required, not the culture of the organism. That is what you have to emphatically realize. A 70-year-old with a history of fever, cough and purulent expectoration. He had been alcoholic and chest radiograph has been shown to you. In this chest radiograph, what you are able to see, doctor? You are able to see consolidation. But consolidation has made the fissure, the horizontal fissure to bulge down. So this is called bulging fissure sign. So typically when Klebsiella pneumonia lead to a lobar pneumonia, it lead to development of the bulging of the fissure, which is a very classical radiological feature of the Klebsiella pneumonia, is what you have to basically understand. Already looking at the history itself, you can answer. You don't need X-ray also. Alcoholics में आने वाला pneumonia क्या होता है? Classically Klebsiella. So now, doctor, Jollinger-Ellison, the best test is secretin injection test, is very definitive test. Now you are able to see on the liver biopsy. इस liver biopsy को देखे तो what type of necrosis आपको याद आ रहा है? And that type of necrosis, where do you see, is the question. What is this necrosis called as? Who will give me the answer? Correct answer. Please punch your answer, doctor. Good to see 64 online students even on Sunday. Good. So please share youtube.com/onlinembbs. In all your social platforms you are connected, Telegram or Facebook or WhatsApp groups where you are, and tell your friends that every Sunday we have a full-scale grant test and then there is a discussion in the afternoon. So what is your answer, doctor? इस necrosis को क्या कहते हैं? Okay, let us play little dumb charades. Dumb charades. Okay, so not dumb charades. We are not dumb. So lunch time में क्या खाते हैं आप? इसको क्या बोलते हैं? Meal. So now tell me, what is this necrosis called as? Anybody? After getting the clue, lunch time में क्या खाते हैं? Chronic active hepatitis. मगर इस necrosis को क्या कहते हैं? What is the word used for this necrosis? Come on, shoot your answer, doctor. Yeah. So very good. Ritu Raj is right. Piecemeal necrosis is what you need to remember. So piecemeal necrosis is a feature of chronic active hepatitis, is what you have to basically remember. So you have the hepatocytes and there is an enlarged portal tract with mononuclear inflammation, and that is called as piecemeal necrosis, is what you need to basically understand. Unconjugated hyperbilirubinemia is a feature of Gilbert syndrome. Then 27-year-old male has fever, arthritis, and the painful nodules which are shown here. What are these painful nodules called? Erythema nodosum. Erythema nodosum is also called paniculitis, is what you need to remember. Pathologically, it is panic, that is inflammation of the fat. Inflammation of the fat, subcutaneous fat, is called paniculitis, which is clinically called erythema nodosum. So, where do you get erythema nodosum? Classically, in ulcerative colitis, you get erythema nodosum is what you have to appreciate. Ranson's criteria may amylase is not included. That is the point you should know. A patient has severe gastroenteritis with pre-renal failure. If the pre-renal failure is there, are the tubules functioning? So what is pre-renal failure? Pre-renal failure. So typically you have a glomerulus, the Bowman's capsule, and these are the renal tubules. So pre-renal means there is a decreased blood flow, because of that there is a decreased GFR. When there is a decreased GFR, such a renal failure is called pre-renal. But in these people, the tubules are still functioning, so they will try to retain the sodium. So that is the reason urinary sodium will be low. Fractional excretion of the sodium will be less than 1% whenever there is a pre-renal failure, is what you need to remember. So what is the except about it, doctor? Except about this condition, you should remember that urinary sodium will be less than 20, because tubules are functioning and tubules lead to the reabsorption of the sodium. So urinary sodium will be less than 20 in case of the pre-renal failure, is what you have to remember. A 4-year-old male child has painless hematuria for several months, and on examination there is a non-ballotable mass detected in the right loin. So you have been given, the age is being given to you. Non-ballotability is an important clue. So what is your answer, doctor? You like to call it as which tumor? Question number 225. Very good. Sara, Kadari, Vanisri, everyone is saying Wilms tumor. Absolutely, Wilms tumor. Now, you are being shown a drug called drug A, which is typically acting on sodium potassium 2 chloride channel in the loop of Henle. So, whose mechanism of action does this drug A represent? So, it's an easy question. Furosemide is the one which is a loop diuretic, is what you have to remember. Now, in the case of pregnant women with cerebral malaria, they may develop convulsions. Convulsions can be one of the important complications. So now doctor, one of the very important thing हम यहाँ चर्चा करेंगे. इसके पहले भी हम we have discussed this point many times in our daily evening class discussion. So let me tell you, doctor, there are 1100 MCQs from the past 15 years of all India, divided into 50 topics and discussed in about 35 hours, and they are made available in the onlinembbs.com video library. So please call our helpline 9000-868-356 and take a subscription. Free is always free. We are definitely free. But at the same time, you need to do a revision. For that, you need to have a definite plan. So about 600 hours of video lectures are made available, topic wise divided, along with the mock tests, real mock tests you can take. With negative marking, you can get the score. For all that, I suggest you to take the subscription. Now doctor, what is the choice of anti-malarial in pregnancy? You have to be very sure. Forget about for entrance. You are living in India, जहां TB बहता है और malaria रहता है. So, all trimesters, what is a choice anti-malarial doctor? First line choice always is chloroquine. In pregnancy we are talking about a pregnant woman we are talking about. Chloroquine and quinine. Second line क्या होता है? Artesunate, artemether and arteether. Absolutely safe in pregnancy, but second line. All trimesters में. Second and third trimester में, with caution, what are the drugs that can be used in second and third trimester? Pyrimethamine and sulfadoxine and mefloquine. These are considered to be in second and third with caution. But what are those anti-malarial strictly contraindicated? आपका अपने आप का एक 200 pages notebook रखो डॉक्टर. Unforgettable things लिख लेना. PG diary, PG entrance prep diary, right? So it is like the collection of love letters you have, which you see after about 25 years, they look like a precious asset, right? Of course. The generation has changed. Nowadays in the 25 years, people will change 3-4 partners, that's a different story. But once upon a time, like that, आपका 200 pages book एक रखना है और every time you feel very important, I need to remember, I need to share with others, लिखना है. And whenever you go to reading room, revise करना है, right? So you may have PowerPoints, you may have lot of printed books, वो सब अलग चीज है. अपने आप का 200 pages notebook diary रहता ना डॉक्टर, that is going to really make a lot of difference in your preparation. So ये diary में जाने वाला matter है. So contraindicated drugs क्या होता है डॉक्टर? Primaquine, contraindicated. Tetracycline, contraindicated. Doxycycline, contraindicated. Halofantrin, bilkul contraindicated. So these 4 are contraindicated in pregnancy, is what you have to basically understand. So now doctor, a patient is presenting with an acute flaccid symmetrical ascending paralysis and his ENMG findings with the CMAP values have been given in acute stage and during recovery. During acute stage and recovery. CMAP value was 7 millivolts after recovery, but during acute phase it is only 0.5 millivolts. So looking at this, you should diagnose what this condition is. By now you know what it is. You don't need to even look at this ENMG. ये story से ही आप बोल सकते हैं. Acute flaccid symmetrical ascending type of a paralysis means आपको अभी तक समझ में आना. So what is accept about it? So what is correct about it? There is an albuminocytologic dissociation in the Guillain-Barré syndrome. Albuminocytologic dissociation, where the pleocytosis is disproportionate to the rise of the albumin, is what you have to basically remember. Okay, doc. Now, a 65-year-old male, he complains of difficulty in writing. On examination, there is a resting tremor, expressionless face, small stepping gait. Then what is the most likely diagnosis? Parkinsonism is the most likely diagnosis. Rat, rigidity, echinacea and tremor is what you have to remember. I am so happy to see 68 online students. You are my best ambassadors. You need to bring another couple of your friends and we make about 100, 200 every time we have a live interactive discussion. जितना भी वीडियोस हो डॉक्टर, लाइव इज लाइव. लाइव में आपको एक टीचर है, क्लासमेट्स है, कम्युनिटी है, इंटरेक्शन है, कुछ पढ़ाई के बात होते, राइट? सो दैट्स द रीजन ऑलवेज लाइव इज लाइव. Once upon a time, face-to-face class with about 100 students sitting, no interaction. Actually, we think it is interactive, but it is not really interactive. You can't be able to chat and talk to the teacher. And it's very costly. But now, the live online, thanks to the YouTube, that at your own convenience, anywhere you can see it. YouTube app is available in everybody's phone, and it is a high-density live broadcast. Splenic atrophy. Where do you see? Sickle cell disease, celiac disease, thrombocythemia. In all these things you find splenic atrophy. The single most powerful predictor of the prognosis in this given condition, whose bone marrow biopsy has been shown to you. Bone marrow biopsy को देख के आपको क्या लग रहा है? What is your diagnosis? You are able to see, no doctor. All these dots, blue colored ones. They're all plasma cells. Plasma cytosis means multiple myeloma. Multiple myeloma में serum beta 2 microglobulin is the single most powerful. The level of the serum beta 2 microglobulin is the single most predictor is what you need to remember. Jitendra thought leukemia. And another friend of us thought it as Burkitt's, no sir, plasmacytoma, right? Multiple myeloma. Which of these originate from T cell? Mycosis fungoids originate from T cell. Constipation, lethargy, dry skin, puffy face, non-pitting fetal edema, they're all suggestive of primary hypothyroidism, where you have a low T3, low T4, high TSH is what you should remember. Hyponatremia is a feature of SIADH, not diabetes insipidus. SIADH means inappropriate ADH production is there. And why SIADH lead to development of hyponatremia, doctor? What is the reason for that? One of the favorite questions of the examiner. SIADH में hyponatremia क्यों होता है? Once you have SIADH, there is excess antidiuretic hormone. So that is the reason your collecting duct where ADH acts, there is excessive water reabsorption. Don't tell that water will dilute sodium and hyponatremia occur. No, that is not the reason. That is not the reason for hyponatremia and SIADH. It is not dilutional hyponatremia. Yeah, water is reabsorbed. वो तो ठीक है. Increased water reabsorption lead to increased plasma volume. When plasma volume increases, the atria become stretched. When they get stretched, they produce ANP, atrial natriuretic peptide. That atrial natriuretic peptide comes and acts on the kidney, and typically it will lead to sodium reabsorption stopped and makes the sodium lost into urine. Natriuresis it will lead to. That is the reason what is one of the important criteria? Urinary sodium elevated. Urinary sodium is the one of the part of the definition of SIADH is what you have to remember. So SIADH lead to development of hyponatremia because of increased plasma volume leading to atrial natriuretic peptide leading to natriuresis is what you have to basically understand. Now doctor, 50-year-old chronic liver disease, heart failure, and what you are seeing, there is a pigmentation. So pigmentation with liver disease, with heart failure. What comes to your mind, doctor? Diagnosis. You should think of primary hemochromatosis is the one which causes the combination of all these three is what you should remember. Now, you are being given a MRI. MRI के अंदर आपको क्या दिख रहा है? What is that animal whose face comes to you? There is a Hollywood movie on the name of this animal. हाँ, अभी बोलो. It's a cartoon film. It is a cartoon film. This animal's face is a cartoon film, very famous. What is that? Panda, Kung Fu Panda. That's right. So this is called panda sign. So whenever there is deposition of copper, then you get this panda sign in Wilson's. So in Wilson में क्या क्या आपको रहता है? There is a Kaiser-Fischke ring, there is a low plasma copper, degeneration of basal ganglia, extrapyramidal features, rigidity. That is, rigidity, spasticity are the signs of hypertonicity, not hypotonia. So that is what you have to basically remember. It is not hypotonia, it is the hypertonia is what you basically come across. A patient has HIV infection, rapidly progressive painless visual loss, and the fundus is being shown to you, right? So इस fundus को देखे तो what is the favorite food Italians discovered, doctor? Dash hut. What hut? Or a dash corner. What is that food discovered in Italy? Right? Lot of millennials order करते हैं स्विगी में. किसको ऑर्डर करते? Which food को ऑर्डर करते? वो फूड पिज्जा पाई. शिल्पा रेड्डी जिंदाबाद. So pizza pie appearance, all that blood looks like the tomato ketchup that you put. So pizza pie appearance is what you need to remember. So typically it is a sign of CMV retinitis. CMV retinitis में ganciclovir is considered to be the treatment of choice. The most common extrasalivary gland involvement in mums typically is asymptomatic meningitis. Rickettsial infections में trench fever is not fatal. That is the point you need to appreciate. Remaining are all true. Eschar is found when there is a tick or mite-borne typhus at the site of the bite of the tick or mite. You typically get a eschar. Wheel felix is non-specific, and vascular endothelial cells are the favorite area attacked by the Rickettsia. So they are all true. So trench fever का दूसरा नाम है 5-day fever. What is it called? 5-day fever is what you have to basically remember. So why it's called trench fever? Millions of people got this infection while they are fighting in the trenches in Europe during the World War days. It is not fatal, but it has a slow course, prolonged convalescence. Because of that, you lose a lot of your army men due to trench fever. It is exclusively a human disease. There is no reservoir. It is the Bartonella quintana which is responsible, and the vector is a body louse, is what I want to underscore to all of you. Dementia is a feature of pellagra. What is the incubation period of the infection which is having copper colored lesions on the palms? First of all, what is this infection आप recognize करना है जो आपको दिखाई दे रहे, based on this spotter, clinical spotter in dermatology exam. So what is your answer, doctor? Please punch. What is this infection we are talking about? बाद में उसका incubation period के बारे में बात करेंगे. Okay? So if you want a clue, I will tell you. It is a sexually transmitted infection. हाँ. अभी तो narrow down हो गया ना? हाँ. So what is your answer? It is a sexually transmitted infection. Vanisri says purpura. Oh no. Which is that sexually transmitted infection which can lead to, on the palms, the development of coppery. Absolutely right. Ritu Raj is our dermatologist, chief of dermatology for the today's afternoon. Syphilis doctor, syphilis का incubation period होता है 14 to 28 days is what you need to remember. A patient has deep jaundice, myalgia, fever, develops conjunctival and skin hemorrhages, direct hyperbilirubinemia without elevation of transaminases. What is the most likely diagnosis? Leptospirosis is called Leptospira icterohemorrhagica. Why is it called like that? It leads to development of jaundice. It leads to significant thrombocytopenia that lead to development of conjunctival hemorrhages. So it is a classical leptospirosis. Man is not an intermediate host of filariasis. एक क्वेश्चन सिंपल है मगर इसका रॉन्ग आंसर दिए तो 10,000 people will cross you and go ahead in competition, right? Almost 1.5 lakh students are writing, doctor. Abhi another 80,000 undergraduate final year students are also getting added up next exam mein, and another 20,000 foreign medical graduates. 2,50,000, a 250,000 will be taking the exam if it really comes into force next exam. So that is the reason competition is going to be there. Competition har jagah pe hai. Tomorrow if you are a cardiologist, you have another 10 cardiologists in the city practicing. But at the same time, there are 10,000 people who require a angiogram and angioplasty and stent. So demand bhi utna hi hai, supply bhi utna hi hai, competition bhi utna hai. That is a good sign of growing economy, right? So that is, but the point is, you should be clear on basics, right? Then you will never be hit, right? Now doc, Wuchereria bankrupti. Definitive host is man. Female Culex, Aedes or Anopheles is intermediate host. Infective form is a third stage larva. Mode of transmission is by inoculation, bite of mosquito, and it localizes to the lymphatics and lymph nodes is what you have to be 100% sure about. Benign tertian malaria. What is the treatment? Chloroquine is the treatment of choice. Benign tertian malaria. Zidovudine, if you happen to use, what are the complications? Bone marrow suppression, toxic myopathy, lactic acidosis, they are all. Once more I am telling you, doctor, a test hone ke immediately after this, go back, pharmacology mein HIV drugs ka ek garma garam revision karna. What are individual drugs, mechanism of action, what are the adverse effects, and what are the combinations which are preferable, which combinations you cannot use. All these funda you have to be sure, right? So, efavirenz is known to lead to suicidal depression. Nevirapine is notorious to lead to Stevens-Johnson syndrome. Zidovudine can lead to bone marrow suppression. Protease inhibitors lead to lipodystrophy. Like that. There are certain class effects, individual effects for the various drugs, which you have to be very sure. One question. Without a question on antiretroviral drugs, no NEET to PG, no next exam, right? Now, which drug is not given as intravenous bolus? Xylocaine is not given, but diazepam, chloroquine, diltiazem, they are all given. Gray baby syndrome, chloramphenicol. A patient is admitted with DKA, with sinusitis, with panophthalmitis, with cavernous sinus thrombosis. What else? Only one infection comes to your mind. That would be mucormycosis. Thiamine deficiency typically lead to Wernicke's encephalopathy, wet beriberi with congestive heart failure and peripheral neuropathy. Vitamin D resistant rickets typically lead to development of hypophosphatemia, Very important. What is the type of inheritance, doctor? Caused by vitamin D resistant rickets. Don't forget, there are very few conditions. X-linked dominant inheritance. Dominant inheritance. There are very few conditions. Vitamin D resistant rickets typically is X-linked dominant is what you have to remember. Right, doc? One pedigree के ऊपर definitely MCQ आता है, image based question. Mitochondrial inheritance, autosomal recessive, autosomal dominant, X-linked recessive, X-linked dominant. ये 5 चीजों का पेडिग्री देख के पहचानना है. Without that there is no paper. So हमारे top NEET PG in 120 days program में, in 120 days में pathology was given 7 days. 7 into 5, 35 hours of review of around 60 topics you have to do. Every video has an accompanying PPT, and there is also a comment section where you can upload your comments also, right? So there's a community also available in the onlinemmbbs.com. Inheritance pattern बोल के एक topic discuss किए थे हम. We picked up AIMS, PGI, JIPMER, All India in sub exams का question bank में what are all the questions asked and reviewed. So please take a chance to do that revision in the video library. So doctor, so there are renal stones, X-linked inheritance and hypophosphatemia. They are all the features of vitamin D resistant rickets. Now, these are this purple colored pruritic polygonal lesions. Where do you find them? Typically, they are the features of the lichen planus is what you should basically remember. Palpable purpurae typically are vasculitic purpurae which are seen in meningococcemia. Wax molding posture. Even some of our classmates in the reading room, बैठ गए तो बैठ गए, washroom को भी नहीं जाता. Morning to evening seriously they will be studying. That's called wax posturing. They won't even raise the head in the reading room. उसको देखे तो डर लगता. The other side in the reading room is a mental asylum, right? Somebody will be waving their foot, ethetosis, restlessness continuously. And one of the guy, panicky reaction में, NEET PG नहीं होगा, ये भारत भी नहीं होगा, कुछ भी नहीं होगा, पढ़ना बेकार है, बोल के depression में घूमते रहते. Another guy will be in a mania, right? So, you will find all kinds of classmates. Once more in the life you don't get the chance. As happy as the days of preparation for NEET PG. So, this is the Catatonic Schizophrenia. Now, doctor, Astasia abasia refers to what? Is a very important question. So, it is a hysterical guide. A person who is hysterical typically will show inability to stand or walk in spite of a good motor strength and a very well conserved voluntary coordination. He will be behaving like a paralyzed individual or a hemiplegic individual while walking, which is called Astasia abasia is what you have to remember. Panic attack में क्या होता है doctors? There is fear of dying, choking sensation, fear of losing control, a fear that there is no NEET PG exam. So they are all the examples, right? NEET PG nahi hai to how will 1,50,000 students will fate will be decided? Some entrance to रहना पड़ेगा, right? A 30-year-old female in first trimester of pregnancy. So a next exam के वजह से nowadays panic even crawled into the MBBS students also. One of my very good friend, he's an orthopedic surgeon. His daughter the other day, she is the person who hates to read unless it is before exams. She is in final year MBBS. She said, oh my God, I have to read all 365 days now because this next exam. So there is a reason now this next exam fear is creeping right from first year, right? Huh. So doctor, 30-year-old female, first trimester of pregnancy, past history of abortions, polyarthritis, malar rash, what is that? SLE is your diagnosis. Marfan syndrome में ectopia lentis, aortic aneurysm, increased lower to upper body segment ratio, they're all true. You are being shown these vasculitic lesions, cavitary lesion in the lung, and there is also a flattening of the nasal septum with necrosis. So upper respiratory, lower respiratory, this patient also has hematuria. So what is your diagnosis? Vagina. In vaginous granulomatosis, ANCA, anti-neutrophil cytoplasmic antibodies are typically positive. A 60-year-old, left-sided headache, generalized aches and pains of 3 months duration. ESR is elevated, alkaline phosphatase is elevated. What is the most likely possibility? A high ESR with headache makes you to think of temporal arthritis. Poorly developed breast, webbed neck, Turner syndrome. So it is XO. Philadelphia chromosome 9 and 22 chromosomes. A 52-year-old, wheezing, breathlessness, meiosis, lacrimation. So what are the most likely diagnosis? They are all the classical features of the organophosphor poisoning where there is a excess of acetylcholine. There is a high proportion of newborns suffering from methemoglobinemia. What is the possibility? The local water supply may be having a high amount of nitrate. Nitrates lead to development of methemoglobinemia. Multiple pulmonary cavities, hematuria, red cell casts in the urine, upper respiratory, lower respiratory and the urinary tract involvement makes it the vaginous granulomatosis. Now, ataxia telangiectasia. I know what is your alternative answer you are thinking. Why it is not good pasture, anti-GBM, but multiple pulmonary cavities are there, no doctor. That is unlikely to be in the case of the good pasture. In good pasture, there is an anti-GBM antibody and that lead to development of alveolar hemorrhage is what you have to remember. Ataxia telangiectasia hota hai autosomal recessive pattern of inheritance. You have oculocutaneous telangiectasis, cerebellar ataxia, thymic hypoplasia, genomic instability. Ataxia telangiectasia is one of the predisposing condition for malignancy because of the genomic instability and they have a high sensitivity to the ionizing radiation is what you need to remember. And cardiomyopathy, typically where do you see? Cardiomyopathy is a feature of adriamycin toxicity, chronic alcoholic hematemesis, and there is a lower chest pain, febrile hypotensive, and stony dullness in the left interscapular area. What is the most likely possibility in this given scenario? With stony dullness in the left interscapular area, right? But without any hematemesis during his drinking spree, followed by lower chest pain and febrile hypotensive. So that points towards acute pancreatitis because there is no hematemesis, but drinking alcohol is a predisposing factor for acute pancreatitis. About the penetrating injury of the abdomen, what are all the things that you know? The abdomen need to be completely explored. Exploratory laparotomy should be done only if peritonitis or shock is evident. And they can be treated conservatively if the weapon is less than 3 centimeters in size and it does not lead to any acquired abdominal hernia. Arachidonic acid is the precursor of prostaglandins and leukotrienes, as all of you know. Isoniazid, rifampicin, pyrazinamide in TB What is the important challenge for you to combine all these and then deliver to the patient? Combinedly, hepatotoxicity is very high. That is a limiting factor. Metabolic alkalosis is a feature of continuous vomiting, not diarrhea. Diarrhea में normal anion gap metabolic acidosis होता है, not alkalosis. But vomitings में metabolic alkalosis will be there. That's what examiner want to know. 45-year-old, benign gastric ulcer. Patient is lethargic, drowsy and confused post-operatively. Which dyselectrolytemia comes to your mind? You should remember hyponatremia is an important dyselectrolytemia. There is a deep vein thrombosis suspected in an obese individual after a pelvic surgery. What is the best investigation? Always Doppler imaging. Doppler imaging may you look for the pulsatility. So absence of pulsatility is one of the important features to suggest that there is a thrombus sitting inside the vein. Now, the carcinoma thyroid has been shown to you. You should identify whether this is a papillary, anaplastic, medullary, follicular. Which type of thyroid carcinoma this is? So, what is the correct statement about it? It is a medullary carcinoma of the thyroid, and total thyroidectomy is considered to be curative, is what you need to remember. Which carcinoma of the breast is bilateral, so that you need to do biopsy of the opposite breast also? That is lobular carcinoma. In thrombocytopenic purpura, what is the cause for development of failure in spite of doing splenectomy? If the platelets are falling down, means possibilities are there may be spleneculi, splenosis, or it is only a partial splenectomy. It can lead to the development of the treatment failure, is what you need to understand. Now doc, a 40-year-old acute right hypochondriac pain, can online students can punch whether our speed is okay or you want me to go little slow? Because it's a Sunday grand test discussion, you need to solve the question paper, and then the test discussion is only meant to be a little anchoring for you after the test is over with some important clues. Hence I am going fast, but please tell me if you want me to go slow, we can go slow, otherwise we can go fast. Please punch the feedback. Nandakumar Neharkar says, Jara dheere chalo sir, teji mat chalo. Yeah. So, you should solve this paper, doctor. 3 hours you have to exercise your mind, make a guess and answer the paper. Saturday evening only the paper become uploaded into onlinemmbbs.com. Right? Abbas is saying speed is okay. Chandrakant says speed is okay. Okay. Now doc, no worries Nandakumar, you will get habituated to the speed. Shatabdi Express ke speed आदत हो जाएगा आपको. Now everyday evening जो डिस्कशन होता है वो स्लो चलता है, right? मगर संडे का तो दना दन हो जाना है, like a machine gun we have to finish, right? A 40-year-old acute right hypochondriac pain with fever without jaundice. Intercostal tenderness is there, enlarged tender liver is there. The most likely diagnosis is amoebic liver abscess considering the absence of the jaundice. In case of a hydrated cyst, when you are dissecting, what are the 2 layers between which you are passing? Laminated membrane and adventitia. In दोनों के बीच में you do the excision, is what you should understand. Obstructive jaundice में, what is the first screening test you want to do? Always obstruction, what is the source of obstruction? Any stone in the bile duct. That can have an origin from the gallbladder. So this reason ultrasound abdomen is the first best initial investigation, is what you have to remember. 50-year-old female, recurrent jaundice. pain, fever, smooth enlarged tender liver. What is your diagnosis? So you should remember classically the combination of jaundice, pain and fever makes it choledocholithiasis. The stone in the bile duct is choledocholithiasis. Then this following condition that is being shown to you. What is the condition? You are able to see. This is the gut. Gut is herniating, but entire gut is not. A part of the wall of it is herniating. That makes it Richer's hernia. Richer's hernia is commonly also associated with what? It is also associated with femoral hernia, is what you have to basically appreciate. So Richer's hernia is that abdominal hernia where only a portion of the bowel wall is herniated, and these hernias progress more rapidly to gangrene than the other strangulated hernias, but obstruction is less common. Intestinal obstruction is because only a part of the gut is there, but that part which is protruding will become gangrenous. High chances are there. So Richer's hernia can occur at the femoral ring in about 88% of people. So femoral herniation is a common associated finding in Richer's hernia. Femoral ring is the common location. Now, therapeutic colonoscopy, where do you perform? Colonic polyposis, decompression of the pseudo-obstruction, dilatation of a colonic stricture. A सारे जगह पे therapeutic colonoscopy is the one which is used. Gastric acid output is influenced by secretin, glucagon and gastrin. They all will affect the gastric acid output. Post-vagotomy, if there is a diarrhea, how can you control it? You can use a somatostatin analog in order to control the post-octreotide, etc. The ones which are used for controlling the post-vagotomy diarrhea. Malignant tracheoesophageal fistula. If there is any mediastinal malignancy, it can lead to a tracheoesophageal fistula. So it become collapsed. How can you maintain the patency of it? Endoprosthesis is used. So you can see here, doctor, this is the tracheoesophageal fistula. Trachea आगे है, esophagus पीछे है. इन दोनों के बीच में fistula है. So in order to take control of that, you have placed a prosthetic. This is the endoprosthesis that you have kept passed into the esophagus and sutured it into the esophagus, so that the fistula between the trachea and esophagus is being blocked. So some of you are going to be top oncosurgeons, right doctor? That day when you are a top oncosurgeon, you are going to tell. That Sunday afternoon, first time मैंने endoprosthesis के बारे में डॉक्टर मुरली भरद्वाज सर के क्लास में सुना, and now I am the best endoprosthetic surgeon in the Asia. That is what one day I should listen. I'll be sitting in the audience and wait for that day, right doctor? So increased FSH in a azoospermic male, what does it indicate? Testicular atrophy. Always FSH is high means hypergonadotropic hypogonadism. That means the problem is there in the gonad itself. Testicular atrophy. Primipara has labor for 2 days. She has emergency LSCS on admission for obstructed labor. Dribbling of the urine started on the 5th day. What is the most likely complication that she has passed? It is a pressure necrosis of the bladder, which is a very important complication to be identified in obstructed labor, which you took a little longer time to relieve the obstruction, is what you should understand. Now, what is the most likely diagnosis in this case? The ovarian cyst is twisted. Twisted ovarian cyst is the diagnosis, right? Then what is the most useful investigation for that? The most useful investigation is pelvic ultrasound, and the most appropriate treatment for that would be laparotomy. That is what you need to understand. Intrauterine contraceptive device. What is the true statement about it? If the woman has got a super involuted small uterus, there is a great chance of perforation. And perforation of uterus occurs usually during the time of insertion of the IUCD. And the postpartum period is the time where expulsion rates are very high. If you happen to place the IUCD, is what you should identify. Now, tubal ligation karna hai to, what is the best location? Isthmus is the best location. So, the junction of the medial 1/3 and the lateral 2/3. If examiner gives isthmus, that is the answer. But isthmus nahi diye to, medial 1/3 and lateral 2/3 के junction point जो रहता है, so that is the preferred site of the tubal ligation, is what you should remember. Now, which agent is used for ripening and dilatation of the cervix before medical termination of pregnancy? Mifepristone and prostaglandins. What are the contraindications for the methyl ergometrin for you to give it as a prophylactic management of the 3rd stage of the labor? If you are suspecting multiple pregnancy, organic heart disease, Rh negative mother, they all become the contraindications to the prophylactic management of the 3rd stage of the labor, is what you have to remember. Alma Ata declaration. Health care, primary health care should be universally accessible, acceptable, affordable. That is very important, doctor. Tomorrow, as clinicians, while writing investigations or planning a long-term treatment like antihypertensives or diabetics, always take into consideration the pocket of the patient. Does he have money to afford for all that? Is there any way that I can be able to make a diagnosis by the clinical examination itself in view of my wide experience, clinical experience, and closely monitor the patient and see to that he is well managed within his budget? So that pharmacoeconomics and investigation economics, you should be really good doctor. You want to be a good doctor means that is the most important thing that you should learn and practice. Affordability is very important, doctor, right? And the time period between entry of infection to maximal infectivity, generation time. Disposable medical articles, gamma irradiation. Vitamin E, basically you need to know EFA, essential fatty acids. Lack of linoleic acid will lead to a raised serum cholesterol. Now you will ask me a question. Sir, linoleic acid, which is a essential fatty acid and a PUFA, and serum cholesterol के बीच में क्या संबंध है? We discussed this very recently also. So doctor, how is the cholesterol in the body disposed? There is a lot of cholesterol in the peripheral tissue, adipose tissue, everywhere. It is the HDL that picks it up and brings it to liver and deposits in the liver. How does it do? Why only HDL can act like a scavenger? What is the reason? It has got an enzyme called LCAT, lecithin cholesterol acyl transferase. So this lecithin become lysolecithin. In the process, cholesterol becomes cholesterol ester, and it will be packed in the HDL and taken and deposited in the liver. So this lecithin comes from the polyunsaturated fatty acids, the structure of it. So if the linoleic acid is deficient, then the lecithin is not available for the HDL. If that is not there, LCAT cannot function. If it cannot function, cholesterol cannot be mobilized. That is the reason there is an increased cholesterol if the EFA is deficient. PUFA is deficient, is what you have to remember. That is the reason you will ask patients to use sunflower oil instead of coconut oil, right? Diarrhea induced deaths among children in India, 15 to 20%, doctor. So severe is a problem, right? Of all deaths, 1/5 are because of the fluid electrolyte management में गड़बड़ होने के वजह से pediatrics में. Pan-retinal photocoagulation. Where is it required, doctor? Proliferative diabetic retinopathy में. Braxton Hicks contractions. They cannot be able to initiate a labor. They cannot be able to lead to the progress of the baby, right? So they are named after Braxton Hicks, and they may be excited by rubbing the uterus, but the intrauterine pressure that they create remains below 8 millimeters of mercury, and these Braxton Hicks cannot be able to dilate the cervix. They are the points you need to understand. Polyhydramnios means liquor amnion more than 2 liters, as all of you know. Then polyhydramnios is not seen in renal agenesis. Renal agenesis में होता है oligohydramnios. Saline infusion sonography is also called sonohysteroscopy. Brachytherapy का techniques क्या होता है carcinoma cervix management में? So you should remember Paris technique, 1 application, 120 hours. Manchester technique, 2 applications, 72 hours each repeated after 7 days. Stockholm technique, 3 applications, 24 hours each at weekly intervals. This is the low dose radiation in the brachytherapy. High dose radiation means 5 fractions of 700 centigrade each to point A daily is called high dose radiation. So this brachytherapy radiation techniques is the favorite question of the examiner. So carcinoma cervix, doctor, everything, anything you should know about it. Ovarian cancer में CA 125. Upper limit of CA 125 is 35 units per ml. Testosterone, how much level? If it is more than that, you think of a ovarian pathology like a erinoblastoma. When do you suspect? If it is more than 10 nanomoles per liter. Misoprostol is used for uncontrolled seizures, ectopic pregnancy and mild anemia, not in the intrauterine IUCD. Chromosome type in complete mole hota hai XX. Asherman syndrome is secondary to adhesions that can be because of excessive dilatation curettage or because of the TB-like condition, which can lead to development of adhesions. Genine stress urinary incontinence may, how do you treat it, doctor? Retropubic urethropexy is a technique which is being used. So fundamentally, this is a very important thing for you to understand, doctor, this illustration. You see, this is the bladder, right? And this is the uterus, this is the vagina, this is the rectum, right? Rectum. Now, from the bladder is coming the urethra through which the urine is passing out. So, from the pubic bone, normal urethral support will be maintaining the urethrovesical angle and prevent incontinence. By stress incontinence कब होता है? If this pubic bone से urethra के बीच में जो support है ना डॉक्टर, urethral support, which is maintaining your urethrovesical angle, इसमें गड़बड़ हो गया तो you get stress incontinence. To treat that, you will be doing a retropubic urethropexy is the treatment for stress incontinence is what you need to basically understand. I hope you are able to catch up with this question. फिर भी I'll once more draw it, and whiteboard always helps, doctor. It gives you better clarity, right? So you have the ureter and you are having the vagina. Iske niche you have the bladder and the urethra is passing down, and through that urine is coming. So this is the vagina. Now this is the pubic bone. From here the support is maintaining uretrovesical angle. इस support को कुछ गड़बड़ हो गया तो uretrovesical angle is lost and that lead to incontinence. So you do retropexy, urethropexy in order to restore this support between the pubis and the urethra, in order to treat the stress incontinence is what you have to basically understand. PCOD can lead to hyperestrogenic state and endometrial proliferation leading to endometrial cancer is what you should remember. Artificial insemination, when will you do? If the cervical mucus is very hostile with anti-sperm antibodies, if there is a impotence or premature ejaculation, in all those scenarios you do the artificial insemination. Sheehan's panhypopituitarism, unruptured ectopic pregnancy, laparoscopy is the best way to diagnose. In HELLP syndrome, what do you see, doctor? H is hemolysis, E is elevated liver enzymes, LP is low platelets. Anti-D gamma globulin preventive dose kitna hota hai? 300 micrograms. What percentage of patients with atypia will go into endometrial hyperplasia without atypia can go into endometrial carcinoma? Only 1%. Now, this condition which you are seeing now, what does it lead to? How does it present? First of all, a condition क्या है? इस यूट्रस को देखे तो, उसका शेप देखे तो आपको क्या याद आ रहा है? What is your diagnosis? Right? Should you answer, doctor? Good to see Solu Kumar, little late but latest. Yes. Should you answer, doctor, quickly? When you look at this uterus, uska shape, which uterus comes to your mind? You have to punch the answer. Yeah. Laparoscopically, when you are looking at the shape of the uterus. Yes. T-shaped arcuate uterus is Rituraj. Septate uterus by Praveen Verma. Bidelphius uterus by Jitendra Kumar. Very good. So, Sara Kadri, absolutely right. Bicornuate uterus, doctor. So, in this bicornuate uterus, there is also a right-sided hematosalpinx, and bicornuate uterus presents with recurrent second trimester abortions is what you have to basically remember. Twin pregnancy of the same age and same sex rules out what? Superfetation. So you should know what is superfecundation. So superfecundation means these two are by superfecundation. Fertilization of two ova produced in the same menstrual cycle by two spermatozoa deposited in two separate acts of coitus. Generally, when one ovum happen to fertilize, the second ovum fertilization doesn't occur. In few people it can occur. It's like two sisters but born by two separate acts of coitus, and that's the reason they may not look alike. One can be like dad, completely black, another can be very fair like the mom, right? हाँ, superfetation क्या होता है? If fertilization of two ova produced in two different menstrual cycle, same menstrual cycle है तो fecundation, two different menstrual cycle by two different spermatozoa, then that is called as superfetation. But it is unlikely to happen in human beings because one cycle में ovulation हो गया, fertilization हो गया तो next ovulation हो ही नहीं सकता. So superfetation is unlikely. Fecundation likely. Fibroid with maximum symptoms is a submucous fibroid. So what is the common indication for cesarean section in primigravida? Any dystocia, cephalopelvic disproportion, failed induction, anything can be the common indications of cesarean. So there is a list of the common indications, you should be very sure. And what are the scenarios where you can do VBAC, vaginal delivery, vaginal birth after cesarean? That also you got to be very sure. Obstetrics, 30 out of 30 marks, you can get it, doctor. Obstetrics and gynecology, any surgical subject is like that. Gardasil protects against what? So Gardasil is that human papilloma virus 9-valent vaccine, right? So 6, 16, 18 but not 33. So 6, 11, 16, 18, 31, even 33 is there. Gardasil 9 mein hai. Okay. So primary amenorrhea, where do you see, doctor? Kalaman, Turner, Rokitansky, Kastner, Hausner, but not in Sheehan. Sheehan mein there is regular menses, everything, but because of the delivery there is a pituitary necrosis and that lead to secondary amenorrhea. Not a primary amenorrhea is what you should remember. So that brings us to the end of the today's grand test discussion on Sunday, doctor. Abhi itna discussion आप almost all you spent with me for 1.5 hours. Now could you recognize what are those 5-6 topics that you felt completely clean bowled? If those topics after this session is over, 1-2 घंटा break ले लो, एक TT खेलो. Night is long, young, and abhi sunset ho raha hai. So then you sit, go to the reading room, pick up those 5-6 topics, go to the onlinembbs.com video library, do the revision of those topics and get yourself better. Then this 1.5 hours that you have invested is worth. And it will be more worthy if you happen to take the test, online test leke, you exercise your 3 hours of time and come to this discussion. It will be super duper. So once more tomorrow evening 6 to 8, let's catch up on Chai Pe Charcha with Dr. Murli Bharadwaj. Enjoy a great Sunday evening. And tonight I am going to a second show movie, Super 30. Super 30 movie ko 10:45 show ko ja raha hu. I will tell you how that movie is after tomorrow. Right? Thank you very much.